So thank you for those introductions. This call, Jonathan, is being recorded. Is that correct?
Yes, that's correct.
Okay, so CMS.gov, John sets up these calls for us, and they are being recorded, and they do go on the CMS.gov website. So if you have not looked, when you go to CMS.gov, you go to the far right, which is Outreach and Education, and then you'll see a link to Alaska Native, I'm getting that wrong, American Indian Alaska Native, and then you click on that, and then you'll see something called Tribal Technical Advisory Group, and that's what we kind of belong to. We fall under that. So there is a link to our actual website. We have a website. If you haven't looked at it recently, you might want to. And it's on our brochure. And if you click on the link there on the CMS.gov website, you will get to our tribal nursing home website. So for those of you who are new, you might want to take a look at that. But these calls are recorded, and our best practices papers, which we started last December and do quarterly, those are posted also on CMS.gov. So we're a lot of good things happening with our collaborative. I did announce last time that U.N.I.T.E was moving to a new street address in Albuquerque as of May 22nd. I did email Cheryl and Randella. However, Randella had another meeting. I've asked her to give us an update on our July call, which will be July 20th. Okay? So the first thing I want to do is just kind of review our meeting minutes from our last call, which again was May 18th. Let's see. We talked about our upcoming webinars, which we will be talking again today. We got some new potential members for our collaborative. We talked about our survey results, which we'll talk about again today. We talked about some toolkits that were available. The T-tag, which I gave you an update on April's call, and I can give you an update today on May's call. I was on the T-tag call Tuesday of this week, so we had our steering committee call on Monday the 12th, and then we had, I was on the T-tag call with Joseph Ray on Tuesday the 13th. So Cynthia LeCount was on that call from Administration on Community Living, so was Dr. Parker, and so was John Johns from CMS, and they pretty much keep us on the agenda, the U.N.I.T.E Collaborative, so myself or Joseph Ray pretty much give a little update to all of those calls. There is a video. It's a video. It's new. It's something that the T-Type group put together for tribal leadership to kind of, it's all about long-term support services, which we are a part of. So if you go to CMS.gov, you'll see the long-term support services. We are part of that continuum, and I hope we're perceived as a good part of that continuum. I have to tell you all a story real quickly. I was listening to National Public Radio this morning on my drive in, and they were talking about elder abuse. And one of the things the woman said on the call, and I'm sorry I didn't get who it was, but she said, well, one of the reasons elders don't report being abused, say, by their family is because that, if they kind of just stay in their room, kind of isolate themselves because they don't want someone coming in, finding out kind of how things are really going and throw them, and she actually used this term, throw them into a nursing home. And I thought, that sounds like prison. The terminology there, the nomenclature was so interesting to me. You throw them into a nursing home the same way you throw someone into prison and put them in shackles. And I thought, wow, we still have a lot of work to do on educating people, and not only that, but making sure our nursing homes are not perceived as places where our elders get thrown into, shackled up, and the key gets tossed out the window. That was pretty eye-opening to me to hear that. So I think all of us, and I think that's one of the things this collaborative is about, is looking at best practices and ways that we are never spoken about in that way. So we can talk about that a little bit more. Let's see, we did have Dr. Blythe Winchester spoke on our May call, which was very helpful, and I'd like to thank her for that. Let's see. And I'll give you an update here in a minute on our geriatric workforce enhancement program. Okay, so the next agenda item Give me just a second here. I'm just making sure I follow my agenda or I'll get lost for sure. So we'd like to have an administrator's report. Is there any administrators on the call that could give us a little report?
Well, I'm on the call. This is Tammy, but I don't really have anything to report.
Anything happening? I mean, as far as an administrator, Tammy, and Tammy's new to being an administrator. I'd like to congratulate her for passing her board and becoming an administrator. What are administrators talking about right now, Tammy? What do you...
You know, for us, we've just had the emergency preparedness workshop, and everyone's trying to hit that hard, I know, in the state of Wyoming, to have that complete by November. We have a state Alzheimer, Wyoming Center of Aging, and they are right now this month putting on workshops and trainings on the state that have been really good. And then the QI, we are bringing up, Morningstar is actually going to host for everyone in the state one of the QI workshops. So that'll be happening in July, and everyone's trying to get everything in compliance for that.
Awesome. Who do you report to? Who's your QIO that you guys report to?
You know, we have two gals from Mountain Pacific that are...
Yay, Mountain Pacific!
Yeah, they're quite a distance from us, but we're on the phone with them every week. They're just super helpful. They'll drive here to see us if we need. So very, very awesome people.
And are you in Montana or Wyoming?
Wyoming.
Okay.
So that's your group, right? That's your group.
Those are my peeps. Yes. Is that Pat Fritz and Carol that are coming out there?
Yep. And so we are excited to put on a boot camp training for them.
Yeah, Pat does a great job with those classy boot camps.
They do. She does. Well, both of them have just been, we call them, whenever we're feeling a little lost or a question, and they're super.
Well, good. I'm glad to hear that. I'll pass that compliment along if you don't mind.
You betcha.
That's awesome. So are you guys all hearing this? Anyone that's affiliated with a tribal nursing home, we've got some focuses here, right? So emergency preparedness completed by November. Some stuff on dementia and Alzheimer's, also some training requirements coming up in November, I'm pretty sure, right, Lisa, on the CMS new regulations?
Yes.
Okay, and then also working with your QIOs on QAPI, on not only your QAPI plan, but like, for example, here I'm working with a team from each of our departments on doing performance improvement projects, teaching them how to think that way from a systems perspective, not working as a team, not blaming. We've been acting out some of our draft PIPs at our general staff meetings, and we've had a lot of fun with it. But one of them, we actually held up signs that spelled out, don't say it's not my job. That was one of them. So, because here we're finding when we get down to root cause that sometimes you end up with that. People saying, well, it's not really my job, and then things don't get done. And so getting down to the root cause of why, why aren't things happening the way you want them to happen? You know, why aren't these best practices getting put into place? Sorry, my computer keeps kicking me out here. Hold on.
I think that sounds like a really good way to try to teach the rest of the staff by acting that out.
It's been very helpful. It's been very helpful. Because we're so rural and out here and everyone kind of works different schedules, it's hard to get everyone together at the same time unless it's like the Christmas party. So we actually are, when we're starting now to have monthly general staff meetings, and since we have so many people there, that's a good time to I do little updates on, you know, QAPI and where are we on our disaster plan, and I just get as much in as I can on those moments when everyone's there. So that's actually really helpful. All right, Tammy, anything else?
I don't think so. We're just trying to go through our final audit. We never know what survey will be here from July through December, so we're just trying to be in compliance with everything.
Okay, excellent. Are you talking more financial audits or clinical audits?
Just clinical.
And what
maintenance, just every single possible thing.
Can you give us an example of one clinical audit that you do, that's something you do just automatically or that's been especially helpful?
We do a toothbrush, brushing teeth audit. We do pericare, catheter care audits. We talked today about infection control, and so we're doing some audits with that. Just every possible thing we can think to cover that should be done.
Good. And do you get the staff involved in that, or is that mostly done by, who does that?
Usually our director of nursing or ADON or maybe a charge nurse will go through and they'll work with all the CNAs to make sure, the competency checklist.
Right. Are you doing that, like actually watching them perform it, or is it more what's written on paper?
No, we're watching them perform it, and we're checking records.
Okay, good. Okay, that's good. That's excellent. Okay, anyone else have any thoughts on that? Or questions for Tammy? Okay, so getting ready for survey is kind of always an ongoing thing. I will forward you, let me make a note to do that. I was in Phoenix, every year, the Arizona Department of Health Service and APIC has a one-day infection control for long-term care facilities. I was there last Friday. It was really excellent. The PDF is pretty extensive, but it was done by I think I have her card here. It's her name was Mary Ann Pavia. She's the Director of Infection Prevention for St. Mary's Hospital for Children in Queens, New York. And she was very, very good. She's actually a microbiologist, so it's pretty good information, and I will send everyone the PowerPoint. You might want to take a look at that because she goes over, like, how do you create your infection control plan, because that's something else that's up and coming here this year. And I'm proud to say that I'm working to get APIC certified, so I'll be very involved in our infection control efforts here at our facility. So if anyone wants more information about APIC, let me know. I'd be happy to send you more information on that. Okay, Jonathan, KAI.
Yes. Hello, everybody. I have a few updates for the webinar. The next webinar is June 28th, and it will be on dementia care. It will be a panel discussion. So we will have, on that panel, Debbie Dijak will be the facilitator, Harley Coughlin, Melissa Heflin, Liz Lee, and Dr. Black Winchester. Then in July, we will have our webinar on tribal relationships, and that will be on July 26th, and that will also be a panel discussion. For the Nursing Home Collaborative Best Practices, I talked to Julie today, and she actually interviewed 3 more people. So thank you for those.
Excellent.
It's great. That's going to help us to beef up what we already had written for the best practice support.
Excellent. So Jonathan, how can you give us a total count then on how many phone and how many paper interviews you ended up doing for that?
That would make 6 phone interviews and 2 paper.
Awesome. Okay, and that was partly the work of the steering committee on Monday because we realized we didn't have as many people as we wanted. So thank you to KAI for their hard work on getting that all together.
Thanks to the steering committee for getting us additional people. That was helpful. So we're going to work on making those revisions, and then we'll be sending it out for you to review, Debbie.
Okay.
And those are all the updates that I have.
Okay. So we do have people identified for the July webinar too, right?
Yes.
Okay. I think we're pretty good on that. There were a couple people that I don't think we heard back from, but I know Joseph Ray is going to be on the July webinar. There's a few people. We're still kind of putting that together a little bit. We have a call scheduled for next week on the 22nd for everyone who's going to be doing the June 28th webinar, except for Carly. Did you connect with Carly, Jonathan, to work with her ahead of time?
I did. I reached out to her via email and I sent her some information, and basically provided all the information that she would need for Adobe Connect. But also, I told her that prior to the webinar on 28th, we want everybody to be on an hour before.
An hour before?
Everybody's on. Yes, so everybody's on and connected and work out any kinks they might have prior to the webinar starting.
Perfect. So Carly Clausen is the DON that works with Tammy at Morningstar in Wyoming, and she agreed to be on the webinar, but she was going to be on vacation. So Jonathan was able to work with her before she left, so she can still do the webinar, which is really awesome. So thank you for that. Okay. Very good. The next one would be our grant update. So Rebecca Drummond, are you on the call by any chance? Okay. So Rebecca writes grants for the Tohono O'odham Nation where I work. We are waiting to hear, and unfortunately I don't have anything to give you yet on the HRSA grant, which would give us, it's $100,000. It's a development grant. It would essentially pay for our annual meeting, and we're going to discuss that here in a little bit. And also it would help us really put some bones to this collaborative, and really we could do some strategic planning with that. So I think all that would be really good. So we're just going to kind of wait to hear on that, and I'm really hoping to hear something by July 1st. So as soon as I get a yay or nay from Rebecca, I will let you all know. Okay? QIOs. Lisa, I don't know if Keith, are you on the call? Okay, so Lisa, why don't you give us a little QIO update?
Well, I can just say in Alaska that our probably our biggest initiative is around dementia care, and we're hoping to get Teepa. Well, we're not hoping. We're planning on bringing Teepa Snow, who's an outstanding educator, her shop up here to do some train the trainers. So it looks like it's not going to happen until early next year, which is unfortunate. I was hoping we'd get things happening this year. We'll look at this year as a planning year to prepare for having these folks. We want a certified dementia trainer in each of our 18 nursing homes, and we'll be tapping the CMP funds to make that happen. So that's our big push here, and of course that's other than the new conditions of participation, which are the fire burning in front of everyone's work right now.
So, Lisa, as I have to tell you my story, so we used Relias Online Learning for senior care, and on those curriculums, on those classes, they have a whole bunch of Teepa Snow videos of live webinars that she's done with real audiences. And I was showing one to our assisted living caregivers a couple days ago, and they laughed their head off. This woman is extremely hysterical and funny if you have not heard her. And if you if you have Reliance, depending on what curriculum you have, I would listen to her. She's really good.
And actually, many of her videos are on YouTube.
Yeah,
I've shared those with my nursing homes. We had a period where there was a number of really aggressive residents that were causing some challenges for staff. And I just went and pulled a bunch of TIPA's videos and sent them out. And it was like I'd given everyone $1,000 bonus or something. People were just going nuts for it. So, yeah, she's a really great educator and makes it funny and accessible and also very practicable.
So, Lisa, when you say certified dementia trainer, is the QIO providing that certification, or is TIPA Snow providing that?
TIPA Snow's shop. It's called a Positive Approach to Care Trainer, PAC, is the, quote, certification that she provides, and that's what our nursing home group is interested in. We had an option to work with our GWEP and go through a more I guess the best word is esoteric program for dementia certification, but the sense from staff is it's not as accessible for the frontline staff, and that's what we want. We want what's going to really impact those folks taking care of residents, and I think that TIPA does a really good job of bringing it to that level.
Okay. So those of you listening in tribal nursing homes, this is important stuff because you need to have this. You need all your frontline staff trained. And Lisa, who's your GWEP person? Who are you working with? Is that the University of Anchorage, or who are you working with?
Well, ANTHC, and Melissa, correct me if I'm wrong, but ANTHC and the University of Alaska, I believe, got that grant together. And the individual I've been working with is at the University of Alaska, and she's certified through the dementia program, and she provides the training there at the university. And she left me with one of the workbooks, and we discussed the program at length. But the feeling I got after I looked at it and spoke with some others is that it's probably not the ideal in terms of what's going to really help those frontline staff. So I think we're kind of shifting our focus back more towards TIPA.
Yeah. Okay. So Lisa and Debbie, you're talking about the GWEP grant, right?
Yep. Yes.
That was actually attained by South Central Foundation. They partnered with like a subcontract with UAA, and ANTHC was, worked in there, as well as AARP and a couple other places. But it's actually coordinated through South Central Foundation, and they're focused more on training professionals that are in the senior serving field,
right,
on certain components of long-term care.
So is it a GWEP? Are they funded as the GWEP side, Geriatric Workforce Enhancement Program?
Yeah, and they partner, like South Central Foundation has partnered heavily with the University of Alaska Anchorage.
Okay.
It's a good partnership. It really is.
Yeah.
Like I said, my shift has just been in what's going to be most helpful to those folks that are working in the nursing homes, and I'm not sure that what Sheila's doing at the university is really going to be the best fit. But that's certainly an option I'll be sharing with our group, that this is out there, and don't, if you've already had enough TIPA or you're not married to her particular model, then by all means, we've got this other resource, and it's outstanding.
Okay. So I was also going to say, if you think that this person would want to be part of the U.N.I.T.E collaborative, because we have the University of Arizona GWEP involved, because sometimes that's a funding source too, which if we don't get the grant might be helpful. Now, the University of Arizona GWEP has already said that they will help us with our annual meeting. So just so you know, that's there if the grant doesn't come through, okay? Melissa, is Jordan part of the GWEP group?
I haven't seen his name in the meeting.
Okay.
I've mostly seen Sheila in that meeting as far as university contact.
Yeah, I was just thinking, because Jordan, if he was part of that UAA GWEP, would be a good conduit for both, the U.N.I.T.E and the GWEP group.
Yeah, and I think because he wasn't on staff with UAA yet, they were able to include him into this conversation.
Well, and I can certainly reach out to Sheila. Like I said, my only hesitation is that I don't want to disappoint her in saying, well, we're not going with your program.
Right. So Jordan Lewis, we had actually asked him to do the dementia webinar coming up in a couple of weeks, but he did excuse himself. He had some other stuff, which I understand. And so while we're having you talk, Lisa, can you give us an update? So we did a survey monkey of tribal nursing homes in terms of dementia and tribal relationships. We got, I think, 5 people, right, respond to that.
Well, that was a while ago, but yeah.
Okay, because those results I'm actually going to share. I'm going to share on the June 28th webinar. But my other question is, how is your survey going with all the Alaska nursing homes that you were working on with Dr. Lewis? How is that going?
Oh, well, we closed that survey down a while ago. Let me see if I can just pull it up. If you want to give me 1 sec and talk amongst yourselves, I can pull it up real quick and see if I can give you something.
Excuse my ignorance.
Go ahead. Is that Joseph?
Yes. Does New Mexico have a GWEP?
I have my list, and I will double-check that. I believe you do, but I need to double-check it because when that grant was refunded a year or so ago, it reduced the GWEP by a lot. And I do have the updated list. The other thing you can do, Joseph, if you just Google GWEP 2017, it'll give it to you. You can find it online.
All right.
But I will see if I can find that for you.
Sorry for being late.
Honestly, Joseph, that was one of the things we talked about originally, is getting all the tribal nursing homes affiliated with their GWEP. But it's just something that takes time, and we haven't done it. So.
Yeah, well, it's an ongoing issue at our center, of course, staffing of our CNAs, and then, of course, nursing always.
And staffing might be an issue that we take up next year. That's come up several times as the advocacy piece. The other thing is I am forwarding you care partner sheets, and I am forwarding everyone elder care provider sheets. These are written by content experts, and the University of Arizona edits them, and then they also get them out there on their website and send them out. So I want to say that anyone here that considers themselves a subject expert on the care partner sheet. So if you feel like you really know something well, and it would benefit a caregiver who may be a family member or someone who's caring for someone in assisted living or at home, the University of Arizona is looking for authors. They want me to find at least 5 people who I can vouch for that they're content experts that could write a very short paper. You're writing at a 3rd or 4th grade level. They edit it. It does not have to be, like a research paper where you have to cite things. They're just looking for your experience, basically what you would like to share, and then some resources. So if anyone is interested in authoring one of those, they would be due sometime between now and next April. I would like to have your name sooner than later, and I can send you the template that you use. So it's pretty easy, to be honest. If you feel like you have something to say, like Joseph, I don't know if you'd want to write something on maybe disability, then you could author one of these templates, okay? So just putting that out there. All right, Lisa, what did you find?
Oh, I was just going to say, I pulled up my survey, just kind of quickly skimming over some of the highlights that might be of interest to this group. And it's, I guess, starting with just the prevalence that it looks like between 50 to 75% of residents in Alaska, and I just asked for an approximate. I didn't ask for hard numbers. Percentage of residents have some form of dementia, so that's a significantly high number. Most do not have a memory care or other type unit. I asked about support for culturally appropriate services for and care for residents, how that's accomplished. And some say, yes, we do strive for that sort of thing. We do training. We do a lot to recognize our Alaska Native elders. Others said that they found it to be challenging, especially with the culture. It's difficult to find interpreters. And they're commenting that we're not equipped to deal with moderate to severe behaviors that accompany some of these residents. Asked if they had a model to providing dementia care. Most do not. There were several that used Teepa Snow. One that used the Eden. I asked about staff training on dementia care. Hand in Hand and Relias were tied, and other than the homegrown dementia training programs. Another significant question was, do staff receive training and education on tribal cultures and customs important to the residents in your care? And out of my 15 respondents, 5 said no. 2 do it at new employee orientation and annually. 1 does it at new employee orientation, and the other 3 activity does it. 1 doesn't do it at all, and 1 has it very informally. So we asked, especially for the rural nursing homes, what are some of the unique challenges in providing care? And I got a lot of responses there. A big one has to do with behavioral health. That was, in fact, I would say that would be a theme. If I look at the respondents, the word behavioral health is in almost all of them. So again, it goes back to having these residents with moderate to severe dementia in a rural location without any behavioral support and probably minimal dementia training. Almost none of my nursing homes receive any funding from the tribal organizations to support dementia care. And then, of course, I asked successes and challenges. Successes had to do with music therapy, a lot about music therapy, about food, and consistent assignments. The challenges, training, the environment. One person said every day is a challenge. Individualized activities, and I've heard that as a theme as well, is finding really good, meaningful activities. And a great example of the challenge, and I'm going off my Survey Monkey here now, but for a nursing home with maybe 10 beds, and you've got a range of residents with a mixed bag of dementia, and you've got one activities person, it can be really tough to try and find a meaningful activity for all 4 or 5 of those individuals when one may be, barely able to hold a spoon and the other may be highly functioning. So I think those are certainly real challenges. Mm-hmm. And then we asked, do you have any recommendations on improving, where to go? I just lost anything. Recommendations on improving research services or programs and funding for education. There's never enough training on dementia, education. So these are just, again, I'm just kind of trying to pull some of the highlights that the Survey Monkey, but I would say that kind of touches on the big points.
Mm-hmm. Those are excellent. You know what? Would you be able to just put together a little summary page and just send that to me so that I can maybe share that a little bit on the call, on the webinar on the 28th?
Yes, I can do that for you, Debbie.
Because I can combine that when I speak with what, the other one that we did of just the tribal nursing home. Well, because I think overall it's probably similar.
Well, I'm pretty proud that I had 14 out of 18 nursing homes respond to that survey. So that tells me they are happy to provide feedback around dementia because it's a hot topic for them.
Yeah, I agree. I think it's awesome. Does anyone? We're getting got to watch our time a little bit, but would anyone like to comment on what Lisa just shared that we may want to add? Does anyone have anything you want us to bring out or add on our webinar in 2 weeks? Any thoughts or follow-up, anything that you'd like your audience to know about tribal nursing homes and dementia that's not already mentioned?
Have you, I'm sorry, go ahead. Excuse me.
No, it's all you, Joseph.
Is Rebecca or Randella on the call today?
She could not be. I invited her. Cheryl said she had another engagement, but I asked her to be on the call July 20th.
Here in New Mexico, we have our annual senior conference that's statewide, and they're always looking for topics to present. And I'm just wondering if that would be a proper setting to present some of these topics. That Alzheimer amongst our native population, I think if we could show some survey results there, it will probably bring out other responses or get some other feedback from some of the Title VI. Also, have we been having Title VI representation on these calls?
So Cynthia LeCount always gets invited. She has not been on these calls, but do you think maybe we should ask her to assign someone? What do you think?
I believe she was on the last call.
Sometimes she tries to call in.
Yeah, and she might just be listening also. But I think Title VI director should really be our main channel to getting not so much responses from administrators, of course, but maybe in the Santa Fe area. There's the 10 pueblos up there. 8 northern pueblos, and there's Taos as a major city, and Santa Fe, where I believe their elders get sent for nursing home services. So, again, Title VI is a good place to disseminate our info. Thank you.
Okay. And that kind of leads in to our last topic, which has to do with our annual meeting. Okay, so the steering committee talked about this. We've got a couple options. There's Melissa. Are you still on the call? Can you share the national conference in Bellevue, Washington?
I'm still on the call, but I don't remember what was the name of it because I just Googled it while someone was speaking.
I sent you, I forwarded you an email, Debbie S.J. Evening, with the something that I got from the National Indian Health Board. That is the call for proposals from NIHB for that conference.
I have that. I have it. That's okay, Melissa. I know what it is. I just thought you might want to talk about it. So it's the National National Indian Health Board conference, and it's in Bellevue, Washington. In fact, Cynthia LeCount sent it to me yesterday too, because she was on the call for the T-type call on Tuesday. So it's the National Indian Health Conference, and it's in Bellevue, Washington.
What are the dates?
It's September the 25th, 26th, 27th, and 28th. It's that last week in September. Now, I think we have not, we can do the Title VI. We could have our annual meeting again in Minneapolis with the Title VI conference, But here's the thought that came up at our subcommittee meeting. Do we want to kind of, since we're still so early and young at the collaborative, like we've been part of Banner's conference, and then we were part of the Title VI conference. We've done a poster presentation at NCAI. We've got a connection with U.N.I.T.E and did a poster presentation last year with them. Do we want to reach out? Like maybe our annual meeting should be the National Indian Health Board. That might be, and then we can settle at some point into one area. But are we still at the point where we're trying to get known and make connections? So what do you all think about having our annual conference as part of that National Indian Health Conference?
I think it sounds good.
Well, this is Lisa, and unfortunately, I've got a conflict that week. And I also don't really know what the IH board conference is, but I like the idea of getting out there more.
Okay. I mean, I don't want to pick a time where nobody can come. Is it too early? Are we giving people enough time? Because, you have to reserve a room and get, it's just, there's a lot to think about. Do you guys think that's too soon?
Well, I'll say this is Lisa again from Mountain Pacific. I require a 3-month window if I'm traveling out of state.
Yeah.
It's the kind of weird rules that we have internally here, but and I'm sure I could get to that conference, except that we have our state hospital nursing home association meeting that same week, so I know I would not be able to attend.
Okay. There's a proposal for abstracts that is due July 7th. We could certainly go and present without having our annual meeting there. I mean, that's another option. What do you guys think about that? It's the thing with this conference is it's not specific to elders, just so you know, right? It's not specific to elders.
Well, this is Lisa. I think, again, if I'm going to justify my travel out of state, it's going to have to be at something that is elder, Alzheimer's. I didn't realize that conference wasn't elder focused. I think it would be a harder sell for me personally. I'm only one member of the group, though.
Yeah, I'm looking at 2017 National Tribal Health Conference. It's at the Hyatt in Bellevue, Washington. So the tracks are legislation, regulation, and consultation to improve tribal health, native health infrastructure. So it does talk about facilities there, training and best practices, recruitment, retention, maximizing third-party revenue and expanding patient care opportunities. Medicare is definitely under that. Then there's a Native youth leadership in health, and then public policy, health policy, and systems, which is a little more, like surveillance, epidemiology, emergency response systems. So it's not specific to elders. So if we want to do something specific to elders, then we might want to wait and look at going back to the Title VI, conference. We know when that is, Joseph.
Is Banner Alzheimer's going to do another big conference?
Not that I know of. I did reach out to Nicole Lomay, and I asked her to be a speaker on one of our calls on dementia, and I have not heard back from her. So I don't know. I don't think so. I can also reach out to Jan Doherty and ask about that, although Jan's kind of somewhat retired, but I think she would probably know. I can find out on that. So the conference, the Title VI conference, Joseph, is that in November again?
I believe it's in August.
Oh, really?
Yeah, in Minneapolis again.
Oh, it's in August. That might be a little early. Let me look on their website real quick. Okay. I don't see that. Let's see. Program. Okay, and Melissa, didn't you say there was something in October with NCAI? Did you I think I have a note.
Not with NCAI that I'm aware of.
Are there options? Debbie, can I make a recommendation? Oh, I'm sorry. Go ahead, Tammy.
That wasn't me.
Oh, I'm sorry. Go ahead, Lisa.
I think Joseph was trying to speak.
Okay, go ahead, Joseph.
The annual NCAI conference is in November, and I'm trying to find out where right now.
The NCAI one is October 15th through the 20th in Milwaukee, Wisconsin.
October?
Debbie, what I was maybe going to recommend to the group is why don't you or me or a couple of us, whoever's on the call even, maybe come up with a couple of proposed conferences where, we know we're going to be able to attend and gain some, useful knowledge in addition to our meeting. And again, I'm just speaking for myself, that I know it'll be a lot easier for me to convince the higher ups to sign paperwork to get me out of state if I know that I'm going to be doing more than just this annual meeting. So perhaps we could, bring together a couple of suggestions back to the group, because it sounds like we've got the NCAI, the Title VI. We can look around and see in the next, the fall months if there's anything that would really have a great location and a good content that we could maybe tap into.
Okay, so I'd like to suggest that anyone here who's on the steering committee, that they start looking and thinking about this. If the grant is approved, Lisa, we may be able to, that could give us money that we might be able to just schedule a meeting somewhere without going to a national conference, and that's another possibility, in which case maybe we could get someone like Teepa Snow to come and speak, which would be kind of cool. But I don't know. We'll have to, that's something we'll have to wait probably another 2 or 3 weeks to know about the grant. But that is a possibility too. So would the steering committee members that are on this call, would you be willing to have a quick call, maybe just 30, 40 minutes, sometime between now and our next steering committee, which would be the 10th of July? Because I think we need to do this sooner than later. We need to get this maybe kind of nailed down, because otherwise, we got to give people plenty of time to ask and get permission.
Why don't we commit to each of us getting information to you, doing a little bit of searching around and getting you something in the next couple of weeks. And then I don't even need a call, but we could just share that information out and be ready to make a decision on in July. Or do you think that's too late?
Well, I think the sooner the better. I mean, if you're talking November, I think July's okay. If you're talking October, maybe not. It's getting pretty close. So
True.
But again, we should know on the grant by July 1st, so that's a piece that we don't want to miss too, because then we're more open to just hosting something wherever and whenever we want it too. So that's kind of nice. So, okay. All right, so you guys please send me like a definite date, time, this is the organization, and then we'll go from there.
Sounds good.
All right. Probably moving forward, Lisa, we should probably make these decisions about our annual meeting more like in January or February, is what I'm thinking. Within that first quarter, to get the word out. So
maybe lay out a calendar for the year or something.
Yeah. Okay. All right. Well, it's 1 o'clock. Thank you all. Did Teresa Holt, was she on the call? Okay.
I have Jonathan, Debbie, Melissa, Karen, Lisa, and Tammy. Did I miss it? Oh, Joseph. Did I miss anybody?
Anyone else? All right. Thank you all then. We'll talk again soon. Have a great day.
All right. Thanks. Bye.
Bye.
All right.